We are back, family. Let's get into it. All right. So, I got to go over that medical disclaimer, okay? I am a nurse, but I am not your nurse. Nothing in this episode constitutes medical advice, a diagnosis, or a treatment plan for you or anyone you know. The information I share today is for educational and informational purposes only. If you or someone you love is struggling with mental health, behavioral health, family conflict, or any kind of crisis, please reach out to a licensed healthcare provider, a licensed therapist, or if it's an emergency, call 988. That is the suicide and crisis lifeline, or go to the nearest emergency room. Real help from real professionals. That's always the move, okay? Second, the content note. Today's episode discusses outdated and harmful medical practices related to adolescent mental health, family dynamics, and the historical pathologicalization of normal teenage behavior. Some of what we discuss may be triggering for those who experience dismissive or controlling treatment as young people, or for those who grew up in environments where seeking independence was punished. Take care of yourself. Pause if you need to. Come back when you're ready. This episode isn't going anywhere. Third, the history note. I reference a real medical text from 1953. I'm analyzing it through a modern, evidence-based lens. My goal isn't to mock people from a different era for sport. It's to trace the lineage of ideas that still affect how we treat young people today and to replace those ideas with something better. All right, the disclaimers are done, so let's get into it, okay? Rebellious attitude. That's what they wrote. 2 words, typed up, published, bound in hardcover, and placed on the shelf next to chapters about tuberculosis and broken bones. Rebellious attitude. Not developing independence, not forming her own identity, not pushing back against a system that gave her no voice. No. In 1953, if a teenage girl challenged her parents, if she pushed back, if she questioned, if she dared to have her own opinion about her own life, she didn't get understanding. She didn't get a conversation. She got a diagnosis. And that diagnosis came with a prescription: psychotherapy. Not therapy to help her process her emotions. Not therapy to build communication skills within the family. Therapy to fix her. To correct the defect. To stand down the edges of a girl who had the audacity to think for herself. Welcome back to Battle Tested Nursing. I'm Nurse Mindy, and today we're cracking open that 1953 medical guide one more time. Because last week we talked about how they pathologized a girl's emotions during puberty. And this week we're going after something even more personal. We're talking about rebellion. Or rather, what they called rebellion. What it actually was, why they were so afraid of it, and what we know now about what happens when you try to crush a teenager's autonomy instead of nurturing it. Because here's the thing, and I'm going to say this up front so you know where I stand. The problem was never the rebellious girl. The problem was a world that couldn't handle her. So let's go. All right. Let me read you what the book actually says. And I want you to listen carefully, because there's something interesting buried in here. Something they accidentally got right. Before they go completely off the rails, of course, The 1953 Pictorial Medical Guide, in its section on adolescent behavior, describes a scenario where a teenage girl is challenging her parents, pushing back, arguing, refusing to comply. What we might call today is a Tuesday. And the book's recommendation is that this girl has a rebellious attitude and needs professional intervention like a psychotherapist. Now, on its face, recommending therapy inherently isn't bad. We'll get there. But the framing is everything. The girl is the problem. The girl is the one who needs to be fixed. The girl is the patient, not the family system, not the parents, not the dynamic. The girl. But then, and this is the part that made me do a double take, the book says, and I'm quoting here, little can be accomplished unless the parents are willing to examine their relationship to the girl. Wait. Hold on. Did 1953 did they just accidentally stumble into family systems theory? Did they just acknowledge that the parents are part of the equation? Yeah, they did. And you know what? That part we actually still agree with. That's legitimate. That's essentially the foundation of modern family therapy. The idea that you can't understand or treat a child's behavior in isolation from the family system they exist within. The kid doesn't operate in a vacuum. Their behavior is often a response to something happening in the rational environment around them. So, we got to give credit where credit is due. For about half a sentence, the 1953 book was ahead of its time. And then they immediately ruined it, because the book goes on to say that the girl might refuse therapy. And here's the reason they gave. Because she sees it as submission to adult control. Let me say that again. Submission to adult control. They literally named the dynamic. They said the quiet part out loud. The girl doesn't want to go to therapy because she perceives correctly, by the way, that the purpose of the therapy is to make her submit, to comply, to fall into line, to stop being inconvenient. And the book frames this as a problem with the girl. She's resistant, she's difficult, she's not easily convinced that therapy could help her. But let me ask you something. If someone told you, hey, we're going to send you to a professional whose job it is to make you stop having opinions and do what you're told, what would you be excited about that? Would you be easily convinced? Or would you look at that situation and say, yeah, I'm good. That sounds like a trap. Because that girl, that so-called rebellious girl, she wasn't confused. She wasn't sick. She wasn't broken. She read the room. She understood, maybe better than anyone, exactly what was happening. The adults in her life couldn't control her, so they were outsourcing the control to a professional. And she said no. That's not rebellion. That's intelligence. That's self-preservation. That's a young person with a functioning survival instinct who recognized a threat to her autonomy and responded accordingly. But in 1953, that made her a patient. Okay, let's do something fun. Let's play translator. I'm going to take the 1953 language and translate it into what we'd say today. What the research actually supports. What modern psychology and adolescent medicine actually understand about what was happening with those girls. 1953 said, rebellious attitude. The 2026 translation, autonomy, development, boundary setting, and identity formation. That's what I got. This is not a subtle distinction. This is a fundamental reframe of what's happening developmentally. When a teenager pushes back against parental authority, that's what's actually happening here. Neurologically, psychologically, and developmentally. It's one of the most important processes in human growth. They are differentiating. They are figuring out where their parents end and where they begin. They are testing boundaries. Not because they're broken, though. Nah, but because that's literally how you learn where the boundaries are. Erik Erikson, one of the most influential developmental psychologists in history, described adolescence as the stage of identity versus role confusion. The central task of the teenage years is to develop a coherent sense of self. And you cannot, and I need you to hear this, you cannot develop a sense of self without pushing against the people and the systems around you. It's like trying to learn to swim without getting in the water. The resistance is the process. So when a teenage girl in 1953 challenged her parents, she wasn't malfunctioning. She was doing exactly what adolescent humans are supposed to do. She was on schedule. She was healthy. She was developing. And they called it a disorder. 1953 said she needs to submit to therapy. 2026 for translation, she needs a safe, collaborative space where her voice is centered. The word submit tells you everything about the power dynamic they are working with. Therapy wasn't being offered as a resource. It was being deployed as a tool of compliance. The goal wasn't the girl's well-being. It was the girl's obedience. Modern therapeutic practice, evidence-based, ethical, effective therapeutic practice, operates on the exact opposite principle. The therapeutic alliance is built on trust, not authority. The therapist is not there to tell the client what to do. They're there to create conditions where the client can explore their own thoughts, feelings, and experiences safely and arrive at their own insights. With adolescents specifically, this is critical. Research consistently shows that the single biggest predator of successful therapy outcomes with teenagers is the quality of the therapeutic relationship, not the specific modality of it. Not the therapist's credentials, not the number of sessions, the relationship. Does the teen feel heard? Do they feel respected? Do they feel like the therapist is actually on their side? If a teenager walks into a therapist's office believing, correctly or incorrectly, that the therapist is an agent of their parents, they're there to make them behave, right? That therapeutic relationship is dead on arrival. Nothing meaningful will happen. You might get surface level compliance, but you won't get healing. You won't get growth, and you definitely won't get trust. And that girl in 1953, she knew that. She felt it. She resisted it, and they wrote it down as a symptom. 1953 said, She's not easily convinced. Therapy could help her. 2026 translation. She has a healthy skepticism and needs to be met where she is. Simple, right? This one actually breaks my heart a little, though, because think about what's happening here. A young person is expressing doubt about a process that, in her experience, is designed to suppress her. And instead of seeing that doubt as valid, instead of thinking, maybe we need to rethink our approach to make this actually feel safe for her, they see it as further evidence of her pathology. She's not just rebellious. She's resistant to treatment. She's non-compliant. She's difficult. In modern practice, we have a term for this, and it's not a diagnosis. It's called meeting the client where they are. If a teenager doesn't trust the process, the answer isn't to force them into it. The answer is to earn their trust, to be transparent about the therapy, what therapy actually is and isn't, to give them agency in the process, to give them set and let them set the pace. Motivational interviewing, which is one of the most evidence-based approaches in behavioral health, is built entirely on this principle. You don't convince people to change. You don't argue them into compliance. You explore their own motivations with them and help them find their own reasons. It's collaborative. It's respectful. And it works precisely because it doesn't rely on coercion. That 1953 girl who couldn't be easily convinced, a skilled modern therapist would hear that and think, good, she has a strong sense of self. She's not going to just go along with someone because an adult told her to. That's actually a strength I can work with. But in 1953, it was a problem to be overcome. You know what gets me? The book was so close. They identified that the parents needed to examine the relationship. They noticed that the girl had her own perspective on the situation. They even observed that she was resistant to being controlled. All the raw data was there. But the conclusion they drew from that data was backwards. Instead of saying this girl is a developing human or a human being who needs respect, autonomy, and a family system that can adapt to her growth, they said, this girl is broken and needs to be fixed. And it's going to be hard because she doesn't want to be fixed. Same observations, completely opposite conclusions. And the difference? The lens. The cultural, gendered, power-driven lens through which they interpreted everything they saw. Okay. Let's go deeper on the one thing they got right, because I think it's important, and I think it actually connects to something a lot of you are dealing with right now, whether you're a parent, a therapist, or an adult who's still untangling your own family dynamics. Little can be accomplished unless the parents are willing to examine their relationship to the girl. That line right there, that's gold. And the tragedy is that in 1953, they included it almost as a footnote. An obstacle to treating the girl rather than recognizing it as the entire point. Modern family systems therapy, which really took off in the 60s and 70s with pioneers like Murray Bowen, Salvador Minuchin, I may have mispronounced that, and maybe even Virginia Satir. I probably mispronounced that one too, guys, sorry. Is built on a radical but now well-established idea. The identified patient the person everyone says is the problem is usually a symptom of a larger system dysfunction. Let me say that differently because it's so important. When a family brings in their rebellious teenager and says, "Fix her," a family systems therapist doesn't look at the teenager. They look at everything. The communication patterns, the power dynamics, the unspoken rules, the alliances and the triangulations, the generational patterns. Because more often than not, the kids who are acting out is usually the one who's most honest about the fact that something in the family isn't working. They're the canary in the coal mine. They're the smoke detector going off. And what the family is asking the therapist to do is essentially disconnect that smoke detector so they can ignore the fire. I see this all the time in healthcare. All the time. A parent brings in a teenager who's out of control, arguing, withdrawing, refusing to follow rules. And when you start exploring the family context, you find parents going through a divorce they hadn't told the kids about. A parent with untreated depression or anxiety. Rigid, authoritarian household rules with no room for negotiations. A sibling who's the golden child, while the kid is the scapegoat. Generational trauma that nobody's ever addressed. Financial stress that's creating tension nobody's naming. And a fundamental mismatch between the parents' expectations and the teen's developmental needs. And then the teen, who doesn't have the language or the power to say, "Hey, something is wrong with our family system and I need someone to acknowledge it." They expresses it in the only way they can, through behavior, through resistance, through what the adults call rebellion. That's not pathology. That's communication. And here's where modern family therapy diverges so sharply from the 1953 approach. In 1953, the goal was to get the girl to stop being rebellious, to restore the previous order, to put her back into the box. In modern evidence-based family therapy, the goal is completely different. The goal is to help the entire family system evolve, to improve communication across the board, to help parents understand their teenagers' developmental needs, to help the teenager feel heard and validated, to build mutual trust and respect, not one-directional compliance. It's not about the girl submitting to the parents. It's not about the parents submitting to the girl. It's about creating a family system where everyone has a voice. Everyone's needs are considered, and conflict becomes an opportunity for growth rather than a power struggle. And the research on this is overwhelming. Family-based interventions for adolescents' behavioral issues consistently outperform individual therapy alone. Why? Because you're not just treating the symptom. You're treating the system that's producing the symptom. But that requires something uncomfortable. It requires the parents to change too. It requires them to look into the mirror, to examine, as that 1953 book accidentally suggested, their own relationship to the child. And not just examine it as a barrier to fixing the child. Examine it as the actual work. That's hard. I'm not going to pretend it is not. It's hard for a parent to hear your child's behavior might be a response to something you're doing. That can feel like blame. That can feel like an attack. And a good therapist will navigate that with compassion and skill. But the willingness to look at the whole picture, to ask what's happening in our family instead of what's wrong with my kid. That's where the real transformation happens. And I have enormous respect for the parents that can do that work. Enormous respect, because it takes guts, it takes humility, and it takes a kind of love that goes beyond wanting your kid to behave. It's wanting your kid to thrive, even if that means you have to grow too. So if we're not just diagnosing rebellion anymore, if we're not sending teenage girls to therapists to be fixed, what are we doing? What does modern adolescent mental health support actually look like when it's done right? Let me paint you a picture, okay? Because I think it's important to not just tear down the old model, but to show you what the new one looks like in practice. Modern therapy for adolescents isn't about convincing a teen to comply. It's about creating a safe, non-judgmental space where a young person feels heard and empowered to find their own solutions. That's not a slogan. That's a clinical framework. And every word of it is intentional, safe. The physical and emotional environment matters. A good adolescent therapist creates a space where a teenager knows, and truly knows, that what they say won't be weaponized against them. That includes navigating the tricky boundaries of confidentiality with parents. A skilled therapist will be transparent. Here's what I'm required to share with your parents. Safety concerns, things like that. Everything else, this is your space. Non-judgmental. This is where the 1953 model falls apart completely. You cannot help someone while simultaneously judging them. You can't. The therapeutic relationship requires unconditional positive regard. A concept from Carl Rogers that is foundational to modern counseling. It doesn't mean you approve of everything the teen does. It means you accept them as a whole person worthy of respect, regardless of their behavior. That acceptance is what allows them to let your guard down and actually engage in the work. Hurt. For a lot of teenagers, especially ones who have been labeled rebellious or difficult, the experience of being genuinely listened to is revolutionary. They used to be talked at, lectured, corrected, dismissed. When someone sits across from them and says, "Tell me what this is like for you, I actually want to know," and actually means it, something does shift. Often that's the moment therapy starts working. Not when the therapist deploys some brilliant intervention, just when the kid realizes something is actually listening. Someone is actually listening. Empowered to find their own solutions. This is the part that would have absolutely horrified the 1953 authors, because the modern approach explicitly centers the teen's agency. We're not telling them what to do. We're helping them develop the skills, the self-awareness, and the confidence to figure it out themselves. That's not permissiveness. That's skill building. We're teaching them to fish, not handing them the fish. And definitely not telling them they're wicked for being hungry. And you know what happens when you treat teenagers this way? When you respect their autonomy, create safe spaces for them, and empower them to be active participants in their own growth? They show up. They engage. They do the work. They develop emotional intelligence, resilience, communication skills, self-advocacy. All the things we actually want for them. Not because they were forced to, because they were invited to. Because someone treated them like a person instead of a problem. The outcomes aren't even close Evidence-based, autonomy, supportive approaches to adolescent mental health produce better therapeutic engagement and retention, improved family communications, reduced behavioral issues, not through suppression, but through genuine growth, higher self-esteem and self-efficiency, lower rates of anxiety and depression, better long-term mental health outcomes into adulthood, and stronger parent-child relationships. Compare that to the compliance-based model, the fix the rebellious girl model. What does that produce? Surface level behavioral change that doesn't last, deep-seated resentment towards authority figures, internalized shame, difficulty trusting relationships, difficulty advocating for self in adulthood, higher likelihood of people-pleasing, codependency, and boundary issues later in life. A fundamental belief that your own needs and opinions are problems to be managed. That's not a theoretical comparison. We have the data. We have decades of longitudinal research. We have millions of adult therapy clients who are right now in 2026 sitting in therapist's office unpacking the damage that was done to them when they were teenagers. And their completely normal developmental behavior was treated as pathology. The 1953 model doesn't just fail to help. It actively creates the problems that people spend their adult lives trying to heal from. I want to talk directly to a few specific groups of people right now, and I want you to hear me, not as a nurse, not as a content creator, but as a person who gives a damn. To the woman, no, not just one woman, to the women who were the rebellious girls. Some of you are listening to this and you're in your 30s, 40s, 50s, 60s, 70s, and you just heard me describe your childhood. You were the girl who talked back, who questioned, who didn't just accept what she was told. And for that, you were labeled difficult, defiant, rebellious, problem child. Maybe you were sent to therapy. Maybe you were punished. Maybe you were compared to siblings who was easier. Maybe you were told over and over and over that something was wrong with you. I want you to hear this, okay? There was nothing wrong with you. Nothing. You were developing. You were growing. You were doing the brave, hard, necessary work of becoming yourself. And the people around you, maybe they were doing their best. Maybe they weren't. But they didn't have the framework to see your growth for what it was. They saw a threat. They saw a disruption. They saw a girl who needed to be controlled. And some of you internalized that. Some of you spent years, decades, dimming your own light, being quieter than you needed to be, agreeing when you wanted to argue, shrinking when you had wanted to expand. Because somewhere deep down, that 1953 voice is still whispering, you're too much. You're too difficult. Something is wrong with you. It was wrong then. It's wrong now. And I need you to start questioning it every single time you hear it. Every single time you hear it. Now, to the parents who are raising a rebellious girl right now, okay? I know it's hard. I know it feels personal when your kid pushes back on everything. I know there are days when you think, I just need her to listen to me for 5 minutes. I know the fear, the bone deep parental fear that if she doesn't listen to you, the world is going to eat her alive. I see you. And that fear comes from love. I know that. But I need you to consider something. What if her pushback isn't a problem to be solved? What if it's a developmental milestone to be navigated? What if the same fire that makes her exhausting to parent at 15 is the fire that makes her unstoppable force at 25? The goal isn't to extinguish the flame. It's to teach her how to wield it. And that means the relationship has to evolve. The parenting that worked when she was 7 is not going to work when she's 15. Not because you were wrong then, you weren't, but because she's a different person now. She needs less control and more collaboration. Less because I said so, and more let's talk about why. Less authority and more trust. That's terrifying for a parent. I get it. Loosening the reins feels like letting go, but it's not. It's making room. Making room for her to practice being an adult while she still has you as a safety net. The parents who figured this out, who've learned to shift from commander to coach, those are the parents whose kids still call them at 25. Not out of obligation either, out of genuine connection, because the relationship survived adolescence intact. Because the kid learned that her parents could handle her growth. To the teenagers listening, hey, yeah, you, I know you're out there, probably listening at 2 times the speed because this old lady talks too slow. I get it. Here's what I want you to know. If you're pushing back against your parents, against the rules, against the ways things are, that doesn't make you a bad kid. It might mean you're growing faster than the people around you can keep up with, though. But, and I say this with love, rebellion without direction is just chaos. The goal isn't to fight everything. The goal is to figure it out, what you stand for, and then stand for it with integrity. Question everything, but be willing to listen to the answers. Set boundaries, but do it with respect. Advocate for yourself, but try to understand that the adults in your life are also human beings and their own fears and flaws and unhealed stuff. I mean, they are. You deserve to be heard. You deserve to be respected. And you also have a responsibility to bring your best self to the table even when that table feels unfair. The world needs your fire. Don't let anyone put it out, but also learn how to aim it. Let me zoom out for a minute because I think there's a pattern here that's bigger than any single book or any single era. When you look at the history of medicine, and I mean really look at it, you see a constant tendency to pathologize whatever the dominant culture finds threatening. And the people who get pathologized are almost always the ones with the least power. In the 1800s, there was a diagnosis called drapetomania, a supposed mental illness that caused enslaved people to want to flee captivity. The cure was more brutal control. The desire for freedom was literally classified as a disease. Women who were too opinionated, too sexual, too emotional, too anything, were diagnosed with hysteria. A catch-all that could justify anything from forced bed rest to institutionalization to surgical removal of reproductive organs. Gay and lesbian people were classified as mentally ill until 1973. Being transgender was classified as a disorder until relatively recently, and the language around it is still evolving. And teenage girls who wanted to be their own people, rebellious, pathological, in need of correction. The pattern is always the same. A person asserts their humanity, and a system that depends on their compliance calls it a disease. That should make us deeply uncomfortable, not just historically, but right now. Because if this pattern has repeated itself across centuries and across cultures, we should be asking, what are we doing today? Where are we doing it today? Who are we pathologizing right now that the future generations will look back on with the same horror that I feel looking at this 1953 book? I don't have all the answers to that question, but I think asking it is a moral obligation, especially for those of us in healthcare, especially for those of us who have the power to label and diagnose and treat. We carry an enormous responsibility to make sure our clinical tools are being used in service of the patient, not in service of the culture's comfort. We don't force compliance anymore. We build resilience. That's not just a tagline. That's a philosophical commitment. That's a line in the sand. That's a promise that the healthcare of today and tomorrow will be different from the healthcare of 1953. Not because we're smarter, but because we've chosen to center the patient instead of the power structure. And every time we default to control instead of collaboration, to shame instead of support, to compliance instead of empowerment, we need people who will call it out. Who will point to that 1953 book and say, remember, we promised we wouldn't do this anymore. Before I close out, let me bring the disclaimers back around one more time because this stuff matters. Everything I discussed today is for educational and informational purposes. I shared historical context, modern research, and my perspective as a nursing professional. This is not a substitute for professional mental health care. If you or your family is navigating adolescent behavioral changes, family conflict, or mental health concerns, please reach out to a licensed therapist, counselor, or healthcare provider who can work with your specific situation. Resources can include 988 for the Suicide and Crisis Lifeline, and you can call or text 988 anytime 24/7. Or text HOME, HOME, to 741-741 for the crisis text line. SAMHSA National Helpline. I have a problem pronouncing it. 1-800-662-4357. They give free referrals 24/7. And don't forget battletestednursing.com for our future nurses. Join our community. Get some evidence-based health resources and information that will follow you throughout your nursing school career. You are not alone. Help is available. Asking for it is not a weakness. It's one of the strongest things a person can do. All right, now real talk. We're building something new here. Y'all, and every single episode, every single video, every single post, it's all building towards a community where nursing school assistance is accessible, evidence-based, and empowering. Where nobody gets shamed for asking questions, where we replace fear with facts. But I need your help. I'm just going to be honest. We need viewers before we can sustain this. before we can keep producing episodes, keep putting out those resources, and keep growing this platform into what it's meant to be, we need people to find us. And the way people find us is through you. So here's my ask. And I don't ask lightly because I know your time and attention are valuable. Like this episode, smash that button. Whatever platform you're on, hit it. Share it. Send it to someone. Text it to the friend who was the rebellious kid. Post it on your socials. Tag someone who needs to hear this. Copy the link and drop it in your group chat. Every single share puts this in front of someone new. And you never know who needs to hear it today. Subscribe, follow, and turn on all your notifications because we're not going anywhere, and I don't want you to miss what's coming. This isn't about ego. It's not about clout. It's about reaching the people who need this information and haven't found us yet. And the algorithm, love it or hate it, focuses on engagement. Your like, your share, your comment, that's what tells the algorithm to show this to more people. You are literally the marketing department, and I appreciate you more than you know. So, here's where you can find us. Tuesdays at 8 p.m., Real Talk with Nurse Mindy. That's our Nurse Warrior series where I sit down with real nurses or just telling some of my own stories for raw, honest, no-filter conversations about life in nursing school. On the floor, the trauma we submit ourselves to in the order to provide patient care to the ones who need it. The stories, the burnout, the breakthroughs, the stuff that doesn't make it to the textbooks. If you're a nurse or you love a nurse, Tuesday nights are for you. DM us for if you feel courageous enough to tell your story. We'd love to hear it. Thursdays at 8 p.m., Real Talk with Nurse Mindy, the historical comparison series. That's episodes like this one. The deep digs into the medical history, evidence-based breakdowns, and conversations that turn 60-second videos into full explorations of stuff that really matters. 2 nights a week, Tuesdays and Thursdays, 8 p.m., be there. Okay? Now I have a question for you, and I want you to really sit with this one. Were you ever labeled rebellious for simply setting a boundary? Drop it in the comments. Tell me your story, because I guarantee you are not the only one. And sometimes the most powerful thing we can do is look at each other and say, yeah, me too. And it wasn't okay. Let's air it out. Let's validate each other. Let's build something better than what we were given. Until then, take care of yourself, count your blessings, and I will see you at Tuesday at 8 p.m. Have a great night. Nurse Mindy out.